Okay, so let's have a look at treating a cut. Now, arms, limbs are quite easy to treat and the treatment will be the same. In fact, all bleeds, you just need to be able to adapt the skills I'm going to show you into any different bleed that someone's going to have. Clean the wound, put pressure on the wound, and put a dressing on there. Now, depending on the type of bleed, you might not have time to be able to clean it because actually you need to stop the bleeding. If you don't, they're going to go into hypovolemic shock. Hypo, low, volemic, volume. So low volume, meaning they've lost fluids, therefore their blood pressure is dropping. And you do not want them to go into shock, therefore we need to stop the bleeding. So you can see this casualty here has gone and got a cut on her arm. What you need to do is ideally clean it underneath water. She's putting pressure on there while I go and get my PPE on. It's really important to make sure you have your PPE on. So you're going to put your gloves on. You're then going to go to your first aid kit. And remember, at home, you should always have a first aid kit as well, ideally. But also you'd have one definitely in a workplace. Now you'll be able to get it out and you'll find different types of dressing in your first aid kit. You'll find ones like plasters, which will be for a small superficial wound. Then you've got different types of dressing, small, medium and large. Now I like the medium ones because you tend to have more in a first aid kit. So you've got to grab, in my opinion, the medium dressing, but of course if the wound's larger then you're going to grab a larger dressing, or if it's a very small wound you might get the smaller one. But let's get that medium one. When you've opened it, which can be quite a feat in itself, but open it up and then you're going to find the gauze pad. So unroll it until you see the gauze pad. Now the gauze pad obviously has two sides. One side the bandage goes over and one side where it's nice and shiny. The shiny side is going to go straight onto the wound. The casualty can then put pressure on there as well, or they can hold a spare end for you. Just talk to them, they're conscious, they will do what you want them to do. They want this bleeding to stop as well. Then you're going to wrap the bandage around, unrolling it as you go. This is putting pressure onto the wound. Making sure you've covered both sides so no dirt will get into the wound, and then tie a nice pretty bow, safety pin or put a bit of tape on it, whatever you prefer. Now if blood does start coming through that dressing, what you need to do is remove it. Using a gloved hand, put pressure on the wound. Then when the wound has stopped bleeding, put another bandage on to keep it nice and clean. So one bandage at a time. Now if the casualty goes and cuts their palm, now with a palm wound, if it goes across the way in the palm of the hand like so, the best thing to get them to do is put a dressing there and get them to make a fist, because by making a fist it will actually close the wound. If the wound is up and down, however, if you make a fist it will actually make the wound open, which is worse. So if you've got a wound going across the way, get them to put the gauze in the hand, make a fist, and as you can see in this video here, I'm actually bandaging around and making sure I go over the fingers, so she's kind of got a gloved hand, like a boxing glove. And I normally leave the thumb out, just so you can tie the bandage around the thumb, but that's just my personal preference. Now, with these bandages you've got, you've probably tried those two, you know, the one in the hand, maybe the one on the leg or the arm, depending on what the casualty is. And now I want you to try a head wound. Now when you do a head wound, you've really got to make sure that the bandage goes around the base of the skull. If you go too high up, all your hairs will look like mine. So go down the base of the skull in order to do it. And cover the top and the bottom of the dressing, exactly the same as you would have done if it's on the arm or a leg or anywhere else on the body. Now I've kind of shown you three sort of easy places to have a cut. And of course cuts and wounds are not always that easy. And you just need to be able to adapt those skills I've just shown you and taught you into different kind of situations. So if you've got a casualty at home, get them to come up with a cut somewhere else on the body and just apply the same principles. Clean the wound, put pressure on the wound and put a dressing on there. And please do not forget to subscribe to our channel and hit that notification bell so you get kept up to date with all our latest releases.